Guys, look at me making video back to back. I made a video yesterday, I'm making today. It's the consistency for me.
No way.
Hey guys, welcome back to my channel. My name is Cynthia. If you're new here, you're welcome. So I made a video yesterday about a recap of my first semester in nursing school, and today I just want to talk about my Med Surg 1 class that I had in my first semester. So in my first semester, we had 4 courses: fundamentals, physical assessment, Med Surg 1, and pharmacology. And then for the first 7.5 weeks, we took fundamentals and physical assessments. And for the second part of the semester, we took Med Surg 1 and pharmacology. So in this video, I'm talking about Med Surg 1, my own experience, what I liked about it, and of course, give you my tips and advice for, you out there that you're planning on taking Med Surg 1 or you're thinking about going into nursing school period. Well, I'll be using my book so I don't miss any points that I've taken down already. I'm serious, so I'm serious. I'm serious. Like, I wrote a whole page, of points for you guys, okay? So the Med Surg 1 class can be very intimidating. You can look at it like, oh my god, can I do this? And the first thing I want to let you know is just know you can do it. It's possible. There are people that have done it and you're not the first doing it, so it's doable, okay? My first tip for Med Surg 1 is to read before the class. You really want to get your textbook before your classes starts and actually start reading your chapters, because Med Surg 1 goes into diseases and you really want to know the signs and symptoms, side effects, vital signs pertaining to this disease, what to look out for, fluid and electrolyte balance, and what would a nurse do. More like the nurse role in patient care. So you really want to study your book and also YouTube resources, any other resources you can lay your hands on before your class starts. Med Surg 1 class was more of the instructor just giving a summary of the whole material. I don't even think they didn't teach deeply like they taught in our fundamentals and physical assessment class. Maybe our fundamentals maybe for our fundamental and physical assessment, they thought that we were just new in the program, so they needed to go deep. But in Med Surg 1 class, they already look at you like, okay, you've taken your fundamentals, you've taken your physical assessment, so you know how to take vital signs, you know how to identify signs and symptoms, you know what to do. They start using more advanced nursing key terms or nursing terms when dealing with patients' care. The questions were practical during fundamental and physical assessment, but in Med Surg 1 now is more practical. Like, you need to put so many factors in place before you pick an answer, like the age of the patient, the gender, their background assessments, their health assessments, health history, all of that before you know actually what to do for a patient. So it's more intense in Med Surg 1. A very important tip for studying in Med Surg 1 is to know pathophysiology. I cannot talk more about this pathophysiology. Like, it's really important. Our Med Surg 1 started with diabetes. So you want to know how the body works and what is being affected when someone has diabetes. By knowing how the body system works, it will make it so easy. Trust me, it will make it easy for you to identify, okay, the kidney is not functioning right, so what else is affected, and what electrolyte balance or fluid balance is affecting. It will make sense when you know how the body works. Okay. Most interesting parts of my Med Surg 1 was my clinical experience. Man, I don't know if it was my clinical instructor or my fellow colleagues, nursing students that I worked in the same hospital unit with. It's like, I enjoyed my experience. I enjoyed my clinical experience. I enjoyed the fact that I was working with real life patients and my instructor was just doing an absolutely good job. One tip I want you to take for your clinicals in Med Surg 1 is to be active. You don't want to have an instructor that don't allow you do stuff and then you are okay with it. You're like, oh yeah, my instructor don't let us do nothing. No, you want your instructor to make you do stuff. You want your instructor to push you to go into a patient's room, ask you questions, quiz you right on the spot. Like, you really need that push, because most of the questions that came from my Med Surg, I would just be like, oh my God, thank God that my instructor mentioned this during clinical. An overview of the clinical experience for Med Surg 1 is you being an actual nurse, a student nurse, that you are assigned a patient. First of all, we started with one patient, and as the week went by, we assigned 2 patients. You know, they start increasing it like that. So you assign the patients, you go through their charts, you come in the morning, early in the morning, and then you take reports from the outgoing nurse, you check your vital signs, you go through charts, you check your meds, you pass meds, all of that, all what a nurse will do in a hospital setting. That's what you will do as a student nurse. The only difference is that you're being supervised by your instructor. So for passing meds, your instructor will be there to ask you like, what med is this? Why is the patient taking this med? And she might ask you what the side effect is. So in order for you to learn very well during your clinicals, even if you're being assigned a patient or 2 patients, like when you're less busy in the hospital and you see your instructor trying to teach another student something else about their own patients, I would advise you to just go and stand there and just listen, because every patient is different. So I might have a patient that have heart failure, and then another student might have a patient that just have diabetes, you know, but just be everywhere because you're trying to learn. Ask the nurses. If they're nice, they'll give you tips and they'll answer your questions. Ask the nurses on the floor, that is like the main staff. Ask them questions. Just keep on asking questions, because you are around people with a bunch of knowledge. You are around nurses, you are around physicians, you are around so many medical professions. So just use the opportunity and keep on asking questions and taking notes. Patients that you'll be assigned to, you actually go to this patient's room as a nurse, introduce yourself, take vitals based on what they tell you, check their signs and symptoms, like know what's wrong with them, know the next step to take, pass their meds. You give insulins, you give injections, heparin, depends on what your patient is taking. But like I said, all this will be supervised by your instructor, so you're not doing it by yourself. At the end of every week, we have a medication sheet where we write the names of the drug my patient took for that week, and the usage, what the drug is used for, the recommended dose, the side effects, nursing consideration, all that stuff, and we turn it in to our instructor. That was like our weekly assignment, different from all other assignments we had to do during clinicals. There were so many questions during exams that when I saw, I was like, thank God for my clinical instructor, because there are things that she will tell us that just she will educate us based on the patient we have, or just generally we're just talking and she mentions something, and I'll go to the exam hall and I'll see a question and I'll be like, oh, thank you, because she mentioned it during clinicals. When I went home, I read more about it. I'm seeing it on my exam. Please. So that's why I say you want to be very active and ask a lot of questions during clinicals. They really help. During my clinical, we had like 30 minutes break for lunch, but I tell you, I only went to that lunch break like probably once or twice and during the whole period of my clinical stay in that hospital, because it gets so busy. You have codes, you have needy patients, you're helping out another colleague, you're helping out another nurse. So I advise you to just bring your own snack or lunch in your bag. Most likely snack, something you can just go into the break room real quick and snack on, because before you walk down the elevator and go to the cafeteria to get food, your 30 minutes is over and they need you back on the floor. Another interesting part of my clinical that I enjoyed is the surgical experience. So during my Med Surg 1 clinical, we had surgical experience where we actually go to this operating room and experience, like, witness a whole surgery take place. It depends on the day you go to the operating room and what surgery is taking place that day. But man, I enjoyed my experience. But I have a tip for you. There will be a chapter that will be covered during your Med Surg 1 classes that will talk about that surgical experience, operating, perioperative, I think that's the name of the chapter, perioperative patients. So that's why that surgical experience is very important. You really want to pay attention to details. You really want to ask a lot of questions. And then it's like you are there in real life. So that information will be hard to leave your head. So you just want to give it your time and your attention and really pay attention to it. And by the time you're answering questions like that in your exam, you know, you'll be able to put two and two together. So that brings us to the end of this video. I hope my tips will really help you in your Med Surg 1 class. And, you know, just be determined and just keep on giving yourself this positive energy that is possible and you can do it. And I wish you the best. If you like this video, please give it a thumbs up. You can share it to other nursing students, and please subscribe to my channel so you can get notifications when I post. Thank you. See you in my next video. Bye.